Good day, juniors. Welcome to week 3 of our midterms. Last discussion was focused on human chorionic gonadotropin as a marker for pregnancy and certain malignancies. Likewise, you also had discussion on a viral infection caused by Epstein-Barr virus, and that is your infectious mononucleosis. For this discussion, we are going to discuss another viral infection that can be diagnosed by serologic means. In terms of viral infection, our body naman has the mechanism to eliminate viral infection. We have our innate immune system and our adaptive immune system for that. Our innate immune system will recognize the virus through pathogen-associated molecular patterns. And upon recognition, our innate immune system will be activated. Our NK cells will be induced to perform cytotoxicity against virally infected cells. So our NK cells will produce perforins and granzymes in order to kill or destroy those virally infected cells. Likewise, our innate immune system will also produce type 1 interferons. Interferons are cytokines that can interfere with viral replication. So that is one way to eliminate the virus. And likewise, these interferons can give signals to the neighboring uninfected cells that a virus is present. So, parang yung sinasabihan na, uy, neighboring cells, merong virus dito. So, alert kayo dyan ha, dapat hindi kayo ma-infect. So, parang ganon yung peg. No, now if our innate immune system will not be able to completely eliminate the virus, then our adaptive immune system is there for the rescue. So we have humoral and cell-mediated adaptive immune response. For humoral immune response, we have our antibodies that will act against cell-free viruses. So these are the viruses that are found in our circulation, for example, viruses that are not able to enter the cell. So our antibodies will bind to these viruses, and pag mag-bind ang ating antibodies sa virus, the virus will become inactivated. Tapos, when our antibodies will bind with the virus, 'di ba, our antibodies can act as opsonins. So, if there will be opsonization, our phagocytes will be notified, and our phagocytes will perform efficiently phagocytosis. Likewise, if antibodies are bound to an antigen, they have the ability to activate the complement system. And when the complements are activated, the end product is cell lysis, so destruction of the virus. But if the virus is present inside the cell, if it is able to infect inside the cell, of course, our antibodies will not be able to act against those viruses found inside the cell. So we have our T lymphocytes for that. We have our CD4 and CD8 T cells for that. Our CD8 T cells, of course, they are the ones that will induce cytotoxic activity against those virally infected cells. So they will destroy those virally infected cells. Our CD4 T cells naman, when activated, no, they will help our B cells to produce more antibodies, and they will also help our macrophage to perform efficiently phagocytosis. And our CD4 T cells, particularly type 1 T helper cells, will produce interleukin 2 in order to induce proliferation of our CD8 T cells. And of course, this T cell activation is possible because of antigen presentation. And antigen presentation is performed through MHC molecules. Class 1 or antigen presentation to CD8 T cells is through class 1 MHC, and antigen presentation to CD4 is through class 2 MHC. So for our discussion today, we will focus more on viral hepatitis. So the content of our discussion include the definition of hepatitis and the etiology, and the different agents causing hepatitis. But for this discussion, we will focus only to three: hepatitis C, A, and E. Hepatitis B will be in another discussion. So what is hepatitis? Hepa, so that pertains to the liver, and itis, meaning inflammation, because hepatitis is exactly an inflammation of the liver. Hepatitis can be self-limiting. So when we say self-limiting, the condition will just recover on its own even without treatment. Or hepatitis can be an advanced state, no, in advanced stage. And with advanced stage, there is complete liver failure. And when there is liver failure, it warrants for a liver transplant. Hepatitis can also manifest as either acute or chronic, with acute meaning that is for a short duration, chronic, longer duration. And hepatitis may manifest as either symptomatic or asymptomatic. Generally of the hepatitis is symptomatic. But there are also instances that the hepatitis will manifest as asymptomatic. And this is true to viral hepatitis because there are certain viral hepatitis that will appear as a symptomatic infection. So the patient doesn't know that he is already infected with a hepatitis virus. So we will discuss no kung ano yung hepatitis virus that can cause asymptomatic presentation. So in terms of etiology or the cause of the hepatitis, it may be due to an immunologic response or immunologic damage, no complication because of an immunologic response that triggers a damage in our liver. No, pwedeng autoimmune mechanism din. Or pwede ding exposure to certain toxic substances such as commonly alcohol or pwede din drugs, poisons, and chemicals. Remember that it is our liver that acts as sieve or salaan. So anything that is toxic, once ingested, it will be metabolized by our liver first. Ginagawa ni liver is it converts toxic substances to harmless substances, no? Yun yung metabolic function ng ating liver. And in terms of hepatitis, it may be because of an infection. Infectious agents may be fungi, parasites, bacteria, or viruses. And viruses are the most common causative agent of infectious hepatitis. With infectious hepatitis, we can subcategorize the agents as primary or secondary. For primary, we have hepatitis A, B, C, D, E, and G. But for our discussion today, we will focus only on A, C, and E. Kaya sila tinawag na primary hepatitis is because they can cause direct damage to the liver with little effects on other organs. Meaning, these viruses have tropism to our liver primarily, tsaka wala masyado silang effect on other organs. The virus ha, yung pinag-usapan natin dito virus. The virus has direct effects on our liver. They don't have direct effect or little, they have little to no direct effect on other organs. Yun yung characteristic ng primary hepatitis virus. So, ano yung manifestation or signs and symptoms of viral hepatitis? Viral hepatitis may start with non-specific symptoms. Non-specific symptoms include flu-like symptoms. Ganun naman talaga with viral infection, they first start with flu-like symptoms. So, with flu-like symptoms, the patient will feel fatigue, no, parang mayroong tangkaso, parang magkaka-fever, ganun. That's the general presentation kapag ka mayroong viral infection. Specific symptoms for viral hepatitis include abdominal discomfort, particularly on the upper right quadrant of your abdomen kasi that is where your liver is found. And ano pa? Yes, exactly. Jaundice. Diba very common pag meron tayong nakita na yellow individual, una talaga nating maiisip is merong hepatitis yung patient. Pwede ding magkakaroon ng darkly colored urine ang ating patient. Pwedeng darkly colored yellow or pwede din amber in color. And the stool of the patient is pale in color. Bakit kaya? Bakit kaya yung urine niya darkly colored pero yung stool niya is pale color? Okay, ganito kasi yun. What is responsible for the darkly colored urine in patients with hepatitis is due to the presence of bilirubin. Now, bakit merong bilirubin sa urine? Kapag meron kasing hepatitis or liver damage ang ating patient class, the tendency is that bilirubin will leak out of the liver going to the circulation. So bilirubin will accumulate in the circulation, and once it accumulates in the circulation, it has a tendency to become deposited in our tissues. Kaya nagkakaroon ng yellowing of the skin. So the yellowing of the skin is because of the deposition of the bilirubin in our skin tissue, or the yellowing may also manifest in the sclera of our eyes, and that is again because of the deposition of bilirubin. The darkly colored urine is because of the abundant amount of bilirubin in our urine. Now, bakit merong bilirubin sa urine? Remember, when your bilirubin is found in our circulation, in your blood, therefore, your bilirubin may be filtered out by our kidneys because our kidneys will filter our blood constantly. Diba? Yan naman talaga yung function ng ating kidneys. So, the kidneys will filter bilirubin, and bilirubin will be excreted via the urine and will appear in the urine as bilirubinuria. Now, pero bakit kapag stool, pale ang color ng stool ng patient? Kapag meron kasing liver damage ang ating patient, there will be cholestasis. When there is cholestasis, there is decreased flow of bile into the small intestine. So, kapag decrease ang flow ng bile, there will be decreased concentration of bilirubin that will reach the small intestine. No? So, what is the importance of that? Remember, ano ba yung pigment that is responsible for the brown coloration of our stool? Yes, exactly, stercobilin. Now, saan galing ang stercobilin? Yes, very good. Stercobilin is a degradation product of bilirubin. When bilirubin is found in our small intestine, the intestinal bacteria will convert bilirubin to become urobilinogen. And urobilinogen will be further converted into stercobilinogen. And stercobilinogen will be excreted in our feces in the form of stercobilin, giving the typical brown color. But if there is cholestasis, there will be slow flow of bile going to the small intestine. So there will be little amount of bilirubin that will reach the small intestine. So little amount of bilirubin equals little amount of urobilinogen. Little amount of urobilinogen equals little amount of stercobilinogen. Little amount of stercobilin. Therefore, pale ang color ng stool. Now, in terms of presentation, hepatitis may be acute, fulminant acute, subclinical, and chronic. With acute, the duration is short, and acute has 4 phases, which we're going to discuss in a little while. With acute, this is resolvable of course, with appropriate treatment. At saka meron din namang cases of self-limiting. So, pag self-limiting, no need of a treatment, the hepatitis will just be resolved. But meron din cases of fulminant acute. Ano ba itong fulminant acute? Fulminant acute is a form of acute hepatitis that has rapidly progressed to a more advanced state. And with more advanced state, I mean there is hepatic failure. Kasi class, common ang hepatic failure with chronic state of hepatitis. So kung acute lang yung presentation ng hepatitis, tapos nag-progress agad-agad to hepatic failure, so we refer that as fulminant hepatitis. Meron din tinatawag na subclinical hepatitis. This subclinical is the patient has no physical presentation or no physical manifestation of the hepatitis, no yellowing, no palpable liver, no symptoms. Nag-positive lang siya for the hepatitis is because there is demonstrable antibodies in the patient's serum. So, yun lang yung nagpapa-positive sa kanya, the presence of the antibodies. With chronic hepatitis, the duration is longer, at least 6 months, kaya siya tinawag na chronic hepatitis. And with chronic hepatitis, there is a tendency that the patient will progress to an even more advanced stage. And that may progress to cirrhosis or end stage liver disease. So that is why it is very important that a timely diagnosis is made. No, dapat as early as possible ma-diagnose na ng doctor na merong viral hepatitis ang patient para maiwasan that the chronic stage will be para maiwasan ang chronic stage, para appropriate treatment will be given so that the hepatitis will be resolved. Now, the four phases of manifestation of acute hepatitis include phase 1, which is the viral replication phase. So, during this time, the patient is asymptomatic, no symptoms, no physical manifestation, wala. The patient doesn't know that he already is infected with a virus. Um, During phase 1, hepatitis is detectable only through laboratory test results. Okay? In here, mag-increase lang ang or magkakaroon lang ng abnormality with the liver markers. Okay? Mag-i-increase ang ating mga liver enzymes, magkakaroon ng increase in bilirubin. But this is only detectable with laboratory testing. But if the patient will not submit for any laboratory testing, then the patient will not know that he already has hepatitis. The phase 2 is the prodromal phase. The prodromal phase is the initial onset of symptoms, early signs of symptoms. So, meron ng symptoms dito but hindi pa fully manifested ang symptoms. And during the phase 2, there is already indication that the origin of the hepatitis is caused by a viral infection. No? So, how do we know that there is viral infection? Yes, exactly. Through demonstration of antibodies or antigens in the patient serum. So, if the patient will subject himself for antibody screening, so mag-positive na siya for antibodies against viral hepatitis. With phase 3, no, here is already the full manifestation of the symptoms of the hepatitis. So, the patient is already ecteric, no? So, the patient is already yellow, no? Nag-yellowing na, meron ng jaundice ang ating patient. The liver is already palpable because of the enlargement, and there is already cholestasis. And as I have mentioned kanina, when there is cholestasis, there is decreased flow of bile. So the tendency is that bilirubin will escape and will leak out of our liver going to our circulation. And once in the circulation, bilirubin has the tendency to become deposited to our tissues, causing jaundice or yellowing of our tissues. And the phase 4 is the convalescent phase. In here, the symptoms are already resolved. The laboratory tests are within normal limits. In phase 4, you can consider that the patient has fully recovered. So let's now proceed on the very first causative agent that we're going to discuss in this lecture. So that is hepatitis C virus. Hepatitis C is a small enveloped positive sense single-stranded RNA. Tinawag siyang positive sense single-stranded RNA. Positive sense meaning the viral RNA will act as mRNA. Meaning the viral RNA can be directly translated to become viral protein. Hepatitis C belongs to the family Flaviviridae under the genus Hepasivirus. Hepatitis C is considered a major public health problem and it is the most common blood-borne pathogen. Actually, dalawa yan sila. Hepatitis C and hepatitis B. With hepatitis C, blood is a major vehicle for transmission. And hepatitis C is the most frequent cause of chronic liver infection. And hepatitis C also is, with hepatitis C, there is a percentage of individuals infected with hepatitis C to progress into end stage liver disease. Hepatitis C was previously known as non-A, non-B. Hepatitis C is noted for its high rate of mutation. Now, ano bang tendency if the virus is highly mutating? When the virus is highly mutating, that renders evasion mechanism to the virus, meaning the virus can evade our immune system. So, it will be very difficult for our immune system to eliminate the virus completely. Bakit? Ano palang nangyayari during mutation? 'Di ba, when the virus mutates, nagche-change yung kanyang structure, nagche-change yung kanyang nature. So, when the virus changes its structure, no, yung ating immune system will recognize that as new virus. So, magsisimula na naman sa scratch yung ating immune system. So, simula na naman in producing a new set of antibodies for that mutated virus. So, it will be very difficult for our immune system to completely eliminate the virus kasi pa-change yung structure ng virus. And with the high mutation rate of hepatitis C, there are 7 identified genotypes of hepatitis C. Genotype 1 being the most common among the 7 genotypes. Now, ano yung importance of knowing the genotype of hepatitis C? Knowing the genotype kasi will determine the clinical course and response to treatment of the patient. Kasi different genotype has different response to treatment. Tsaka different din yung progression ng disease with the different genotype. Example, genotype 1. 'Di ba genotype 1 ang pinaka-common na Hep C sa US? Genotype 1 is, among the 7, genotype 1 is the most aggressive genotype of hepatitis C. Tsaka genotype 1 din ang pinaka-difficult to treat. Kaya si genotype 1, iba ang set of treatment for genotype 1. Genotypes 2 and 3, for example, they are less aggressive and they are easy to treat. Tsaka iba din yung set of treatment for genotypes 2 and 3. As for other genotypes, iba, no? So, as you can see, when the physician knows kung ano yung genotype ng hepatitis C infecting the patient, the physician will have a bigger picture of the outcomes of the patient. So, the physician will have an anticipation kung ano yung magiging prognosis ng patient. Tsaka, knowing the genotype will affect the treatment decision making of the physician also. Transmission routes of hepatitis C include blood transfusion. Again, blood is a major vehicle of transmission for hepatitis C. That is why, in terms of transfusion, we do screening of blood and blood components for hepatitis C. Organ transplant. Before organ transplantation, donors are also screened for hepatitis C. Kasi if the donor has past infection of hepatitis C, it was found out kasi na if donors are positive for anti-HCV antibodies, the recipient who received the organ donated will become susceptible to HCV infection, or the recipient has the tendency to develop liver disease later. So, as much as possible, the organ donor must be negative for hepatitis C antibodies to avoid poor outcomes on the part of the recipient. Hepatitis C can also be transmitted via needle puncture. That is why hepatitis C is considered an occupational hazard by CDC and OSHA. So tayo, medtechs, we are at risk for acquiring hepatitis C kasi nga we deal with syringe, no? We deal with sharps during phlebotomy. So, kaya dapat careful tayo. IV drug use is the most commonly identified risk factor for hepatitis C transmission. Other transmission include sexual transmission and vertical transmission, meaning transmission from mother to the developing fetus. Here are the risk factors for hepatitis C infection. Again, as I have mentioned, since hepatitis C is transmitted via parenteral, so anything that deals with sharps and needles is a risk for hepatitis C infection. Now, you may wonder, bakit kasali ito dito? Adults who are 50 years and older. These adults are considered the baby boomers, no? Bakit? Ano palang special about them? Why are they at risk for hepatitis C infection? During their time kasi, wala pang strict protocol of screening blood and blood components for hepatitis C. So, if they receive blood during the time before, no, it's not guaranteed that the blood that they received is free of hepatitis C kasi nga wala pang strict screening for hepatitis C before. Now, this indicates na the patient may have acquired hepatitis C during that time of transfusion. Hepatitis C, again, the manifestation may be acute or chronic, mild or fulminant. The incubation period for hepatitis C infection is 7 weeks. With hepatitis C, the manifestation is those of the typical hepatitis. Now, I would just like to emphasize here liver enzymes kasi ginagamit natin ang enzymes as markers for liver function. We have ALT, AST, GGT, ALP, LD, and 5-nucleotidase. ALT and AST, I'm sure you're familiar with these two, alanine aminotransferase, aspartate aminotransferase, or ito yung tinatawag na SGPT, SGOT, no, before. These two are the uh, enzymes that are primarily used to assess liver function. Bakit? Because these enzymes are hepatocellular enzymes, meaning they are found inside our hepatocytes. So when there is a damage in our liver, our hepatocytes will be damaged, will be destroyed, then these enzymes will be released into the circulation. So we can expect that if there is a liver damage, there will be a subsequent increase, significant increase in our ALT and AST. Between the two, ALT is the more liver specific. Gamma glutamyl transferase, alkaline phosphatase, lactate dehydrogenase, and 5-nucleotidase may also be used as liver markers. These four are actually markers for hepatobiliary disease, meaning when there is a disease in both our liver and bile duct, these four enzymes will increase. No? With liver disease alone, GGT, ALP, LD, and 5-nucleotidase will increase. But it's not as much as ALT and AST. If the disease is liver alone, mag-i-increase talaga significantly ang ating ALT and AST. There will still be increase in GGT, ALP, LD, and 5-nucleotidase, but it's not as much as ALT and AST. And as I have mentioned kanina, bilirubin will increase in our circulation. 60% of HCV-infected patients may progress to chronic liver disease, and about 20% of these individuals will further progress into an end-stage liver disease. So these about 20% of those with chronic hepatitis C has the tendency to develop cirrhosis. Hepatitis C may also have extrahepatic immunologic abnormalities. So when we say extrahepatic, meaning affecting organs other than our liver. So it may be in the form of cryoglobulinemia, urticaria, erythema nodosum, vasculitis, glomerulonephritis, but these are merely complications lamang po. Now, example sa cryoglobulinemia. Cryoglobulinemia, globulin, protein, cold or low temperature. What happens in cryoglobulinemia? This cryoglobulinemia may manifest during chronic hepatitis C infection. What happens during chronic state kasi is there is persistent stimulation of our immune system. So, sige produce ng antibodies. And these antibodies will bind with the hepatitis C virus, viral antigen. So, the antigen and antibody complex has the tendency to become precipitated, particularly at low temperature. So, when they become precipitated, it can cause damage in our tissues. If they become deposited in our kidneys, they can cause glomerulonephritis. Or if they can cause, if found in our circulation, they can cause a significant blockage in our circulation. But then again, these are merely complications. These are not the result of these are not due to infection of the virus in those areas. Walang infection ng hepatitis C in the kidney. Okay? The glomerulonephritis there is a result of an immune reaction due to the presence of hepatitis C infection. With acute hepatitis C, the action or the function of our CD4 and CD8 T cells are important in the control of the infection. And alam naman natin kung ano yung activity ng ating CD4 and CD8 T cells. Acute hepatitis C has the typical manifestations of that of viral hepatitis. So, na-mention na natin yun kanina. During acute hepatitis C, there is development of antibodies, of course, but these antibodies may not be detectable in the patient's serum. So there are instances that during acute hepatitis C infection, antibodies are not demonstrable. And when that happens, diagnosis becomes difficult. And if that's the case, there must be another methodology to detect the presence of the infection, which we're going to discuss later. And with acute hepatitis C, there is no demonstration of HCV antigens in the hepatocyte nuclei, Kupffer cells, or sinusoidal linings. With chronic hepatitis, no, this may manifest as either asymptomatic or symptomatic. With asymptomatic chronic hepatitis C infection, there is a good prognosis actually, no? Meaning, with proper treatment, the the disease will just be resolved and the liver will go back to its normal state. But with symptomatic chronic hepatitis, treatable naman ito with appropriate treatment, but there is a tendency that severe symptomatic chronic hepatitis may progress to a more advanced state. Doctors are actually looking at three parameters. When there is symptomatic severe hepatitis, when there is significant elevation in the liver enzymes plus a positive HCV RNA in the serum, these may indicate that the patient may progress to an advanced stage of liver disease. If ganito yung presentation ng patient, the patient has the tendency to progress to an end-stage liver disease. So, yan yung minomonitor ng mga physicians. Tinitignan nila kung ano yung magiging outcomes ng patient. With chronic hepatitis C infection, there may be fluctuation in the levels of the liver enzyme. This fluctuation is because of the presence of HCV neutralization escape mutants. What are these mutants? These are actually variants of HCV that are resistant to antibody neutralization. Remember, when our antibodies will bind to the virus will be neutralized, the virus will become inactivated. But when the virus is resistant, no, kahit pa mag-bind pa ang antibodies to the virus will still continue its activity. No? Kasi nga, resistant sila to the action of our antibody. And these mutants are a result because of the mutation of HCV. So kaya it is very important that a timely diagnosis is made because because the goal of the physician is to give treatment as early as possible so that the patient will not progress to a chronic state. Kasi pag nasa chronic state na ang patient, there is a tendency na mag-progress siya further into an advanced stage of liver disease. So the diagnosis will start with the screening process, of course, and the screening is through the demonstration of antibodies against hepatitis C. So the antibodies may be IgM or IgG. IgM is a marker for acute HCV infection and IgG is a marker of past HCV infection. With with antibody detection, there are two common methodologies for that. We have chemiluminescent assay and enzyme-linked immunosorbent assay. You will have a separate discussion on this sa inyong lecture sa serology. So, we'll just have an overview for now kung ano yung principle ng chemiluminescent and ng enzyme-linked immunosorbent assay. In the chemiluminescent assay, ay siya tinawag na chemiluminescent is because the process here involves chemiluminescence. So when we say chemiluminescence, there is a chemical reaction that resulted into the production of luminescence. Luminescence is light. So in here, gumagamit tayo ng labels. And the labels are chemiluminescent substances. So what is the principle of this assay? For HCV antibody demonstration. For example, so the reagent comes with a solid phase antigen. So example, ito yung HCV antigen. Tinawag siyang solid phase kasi naka-attach siya sa isang solid particle. It may be in the form of a gel or beads or any solid particles. Now, these antigens, okay, what is detected in the patient sample is the presence of the antibodies against these antigens. So, if in the patient sample, merong HCV antibodies, those HCV antibodies will bind to the HCV antigen in the solid phase. So, ayan na, binding. There will be a washing phase. The washing is to remove unbound antibodies. So, ang matitira na lang sa solution is the bound antibodies. Yan na, meron ka ng antigen-antibody complex. And then, the reagent comes with the labeled antibodies. So, kaya siya tinawag na labeled antibodies is because merong label. The label here is a chemiluminescent substance. So, these antibodies are directed against the Fc region of these antibodies here. So, these labeled antibodies will bind to the already bound antibodies. Okay, sa Fc region yan siya mag-bind. Ay, sorry, hindi ito nakabind. Pero mag-bind din siya dyan sa Fc region. And then, upon addition of the trigger, okay, the trigger will cause a chemical reaction, and that chemical reaction will produce a light. And that light will be detected by the machine. So, the more intense the light, the higher the concentration of antibody present in the serum of the patient. So, kung walang light na na-produce, meaning negative for the antibody. Now, you may be wondering, what will happen kung walang antibody na nakabind dito? Kung negative ang patient for the antibody. Kung negative ang patient for the antibody, meaning these labeled antibodies will not be activated. These labeled antibodies will only react to its trigger once these labeled antibodies will be bound to its target, like this one. Okay? So again, this is chemiluminescent because the end product here is a light, and that light is being detected by the machine. So the intensity of the light is directly proportional to the concentration of the antibodies present in the patient serum. Enzyme-linked immunosorbent naman is almost similar to chemiluminescent except that the labels used here is in the form of exactly enzymes. And the most commonly used enzyme label is horseradish peroxidase. So, ano yung principle nito? Actually, pareho lang kanina. So, meron kang solid phase antigen here. And then, what is detected in the patient sample is the presence of the antibodies. If the patient has antibodies against HCV, these antibodies will bind to the HCV antigen in the solid phase. Washing will remove the unbound antibodies. So what is left in the solution are the antibodies, anti-HCV antibodies. And then there will be addition of a labeled antibody. Tinawag siyang labeled antibody because meron siyang label and ang kanyang label is in the form of an enzyme. So there will be incubation para mag-bind ito sila. After which, mag-add ng substrate of the enzyme for the enzyme. This substrate, as we all know, will react with the enzyme. Once the substrate reacts with the enzyme, okay, there will be a consequent change in the color of the solution. So, pag mag-change ang color ng solution, that indicates the presence of the antibodies in the patient sample. And the relationship here is the more intense the color reaction, the higher the concentration of the antibody present in the patient sample. So, katulad kanina, kung negative ang patient for the antibody, the enzyme here will not be activated. The enzymes here are only activated once the labeled antibody is bound to its target, like this one. Okay? So, 'di ba, halos pare-pareho lang sila sa chemiluminescent. Yung pinagkaiba lang talaga nila is primarily on the label that is used. Kasi sa chemiluminescent assay, the label used is a chemiluminescent substance. Luminol ang pinaka-common. With enzyme immunoassay, the label used is an enzyme, and horseradish peroxidase is the most commonly used enzyme label. Ay, sorry. So, if the patient is positive for the antibody, there must be a confirmatory test. And the confirmatory test is a molecular assay in the form of PCR or polymerase chain reaction. Now, why is it important to proceed to a confirmatory test? Well, kaya siya tinawag na confirmatory test that is because to confirm the presence of the infection. There is a tendency kasi that the screening assay will produce a false positive result or a false negative result. So, kaya it is important that the confirmatory testing will be performed. Tsaka class, important din na mag-perform ng confirmatory, particularly for patients who are immunocompromised. Because these immunocompromised patients do not produce antibodies. So, if these patients will undergo antibody screening, malamang negative sila. But it's not a guarantee that they don't have the infection. It may just be because of their inability to produce the antibodies. So, kapag the patient is immunocompromised, the appropriate methodology to diagnose is through molecular technique. Okay? Now, if after molecular testing, kasi sa molecular testing, we will detect here a viral antigen. So, we will detect HCV RNA here. So, if negative, probably the patient has fully recovered from the infection, or the positive reaction here is because of a previous infection, or pwede din because of a false positive screening. Okay? But if the patient is positive, the doctor must be able to identify whether the patient has an acute or chronic form of hepatitis C infection. Because as we have mentioned kanina, very critical ito because chronic infection of hepatitis C has a tendency to progress to an advanced stage. So to prevent that, dapat malaman ng doctor if this is a chronic state. Okay? And with chronic hepatitis C infection, okay, an additional test must be performed. Okay? Liver biopsy is preferred here. Okay? And then, with liver biopsy, i-genotype natin what genotype of HCV is infecting the patient. Diba, remember, I have mentioned kanina that genotyping will determine the treatment decision making of the physician because the workup for treatment will depend on the genotype of the hepatitis C infecting the patient kasi iba ang treatment for the different genotypes. Okay? Particularly kapag ka genotype 1 kasi genotype 1 is so special. Genotype 1 is the most difficult to treat na type of hepatitis C. Okay? Tsaka with genotyping, malaman din kasi natin kung ano yung magiging response ng patient to the treatment that will be given. So, if positive for genotype 1, further, mag-identify ng interleukin 28B associated variant and 2 SNPs. Okay? What is the importance of interleukin 28B? Interleukin 28B is actually a gene that is involved in the immune response to certain viruses, including hepatitis C virus. Interleukin 28B has three variants. Merong CC, CT, and TT. The CC genotype of interleukin 28B, if the patient has the CC genotype, it indicates that the patient has good viral clearance, meaning the patient has the capacity to eliminate the virus even with short duration of treatment. So, effective ang viral clearance ng patient kapag ka CC ang kanyang genotype. Tsaka with CC genotype, with genotyping for interleukin 28B, malaman ng physician kung ano yung magiging response ng patient to the standard treatment. The standard treatment for hepatitis C is pegylated interferon alpha and ribavirin. Okay? Pegylated interferon alpha and ribavirin, ito yung standard treatment for hepatitis C virus. Diba sabi ko that there are three genotypes for interleukin 28B, CC, CT, and TT. Si CC genotype ang most responsive to pegylated interferon alpha and ribavirin. So, if the patient has CC genotype, then the doctor may give interferon alpha and ribavirin as the treatment regimen because the patient is very much responsive to that. Okay? But if the patient has CT and TT genotypes, interferon alpha and ribavirin may not work on these patients. So, the doctor must be able to give another treatment regimen. For CT and TT genotypes, the treatment is tinatawag na direct-acting antivirals. So, yun yung magiging treatment for the CT and TT genotype. So, as you can see, with genotyping and with identification of the interleukin 28B, no, affected ang decision making for the treatment of the patient. And the goal of the treatment class is to eliminate detectable viral RNA in the blood after 6 months of treatment. So, kapag ka na-achieve ito na goal, no, kapag ka hindi na detectable ang level of viral RNA in the blood, tinatawag ito siyang sustained viral response. Okay, and that is the very goal. Okay? Patients exhibiting anti-HCV and have another liver disease can be very difficult to diagnose because the anti-HCV here may be a false positive reaction only. So, if the patient already has another liver disease, it is important na this patient will proceed to a molecular testing. Kasi kung mag-antibody testing ka, hindi na applicable. Kasi nga pwedeng mag-result into a false positive. So, dapat proceed ka na to molecular testing, demonstration of HCV antigen in the patient sample. So, prevention and treatment for hepatitis C, of course, safe needle practice because as we all know, HCV is transmitted via needle puncture. So, vaccines are available, but very difficult mag-develop ng vaccine to hepatitis C because, yes, exactly, rapidly mutating ang virus. So, the vaccine that may be available now may not be available to certain patients because of the high rate of mutation. And the standard treatment for hepatitis C is pegylated interferon alpha with ribavirin, particularly for genotype 1 with interleukin 28B CC genotype, and pwede din direct acting antivirals. So next is hepatitis A virus. Hepatitis A is also known as infectious hepatitis, and it is considered as the short incubation hepatitis because among the viral hepatitis, si hepatitis A ang may pinaka-short na incubation period. Hepatitis A is the only hepatitis virus that has been successfully grown in cultures, and it is primarily a disease of the children. Hepatitis A is non-enveloped positive sense single-stranded RNA. Again, positive sense because the viral RNA itself will act as an mRNA that can be directly translated to viral proteins. Hepatitis A belongs to the family of Picornaviridae under the genus Hepatovirus. In terms of transmission, hepatitis A may be transmitted via blood transfusion and sexual transmission, but these are uncommon transmission routes because the most common transmission route of hepatitis A is fecal oral. So, what are the risks for hepatitis A transmission? Since fecal oral ang pinaka-common na transmission route for hepatitis A, when you are living with unsanitary conditions that will pose you a greater risk for acquiring hepatitis A infection. So, unsanitary living conditions include poor sanitation and poor hygiene. Or if you are living in a facility or community that is overcrowding. No? Kasi 'di ba overcrowding, maraming tao and we don't know the hygiene practice of those people. So, at saka with overcrowding, very little space. So, talagang mabilis ang transmission kapag there is overcrowding. And there is increased transmission to children because young children, kahit ano lang kasi yung sinusubo nila, no, sa kanilang bibig, no, particularly na yung mga toddlers. The signs and symptoms of hepatitis A manifestation is similar to those of other hepatitis. No? So there is elevation of liver markers such as liver enzymes. There is jaundice. No? There is ecteric phase of the patient. So, yellow ang ating patient. Ito yung mga typical manifestations. But patients may also manifest as anecteric. So, no yellowing, no jaundice. Or pwede din subclinical. Wala talagang physical manifestation. Merely positive for the antibodies against hepatitis A. Now, di ba na-mention ko kanina that hepatitis A has the shortest incubation period. Please take note that hepatitis A has only 2 to 6 weeks incubation period. Meron ding atypical presentation of hepatitis A. The atypical presentation of hepatitis A is a prolonged intrahepatic cholestasis. So again, with cholestasis, there is decreased flow of bile into our small intestine, and the tendency is that bilirubin will leak out of our liver going to our circulation. So in the circulation, bilirubin will accumulate, and there will be dramatic elevation of bilirubin in our blood as high as greater than 20 milligrams per dl. And because there is elevation of bilirubin, this bilirubin may become deposited in our tissues and jaundice may manifest. With atypical presentation, this is a relapsing course. So when we say relapsing course, pwedeng magpabalik-balik. Kunyari, ngayon naka-recover na ang patient. And then later, after some time, magkakaroon na naman ng hepatitis. And with relapsing course, minsan, the relapse will manifest as more severe than the previous manifestation. And with hepatitis A, there is also involvement, extrahepatic involvement. So similar to hepatitis C, there is immune complex deposition in our tissues. But generally of the hepatitis A is actually self-limiting. So meaning the infection will just resolve on its own even without treatment because our immune system is able to completely eliminate the virus with hepatitis A. Diagnostic evaluation of hepatitis A includes screening. With the screening, it's the demonstration of hepatitis A antibodies. Demonstrable antibodies are either IgM and IgG. IgM is a marker of acute infection, and IgG is a marker of past infection. With hepatitis A infection, there is no chronic infection. Again, let me repeat that hepatitis A infection does not progress to chronic infection. Hepatitis A is acute, and most of hepatitis A infection is self-limiting. So, of course, it starts with manifestation of the signs and symptoms. So, the patient will complain of yellowing, uh, abdominal discomfort, and other manifestation of a typical hepatitis. So the doctor will order for antibody screening. Okay? And tsaka, tatanungin, 'di ba, maghi-history taking naman talaga yan. So, mag-identify ang doctor niyan ng risk factors. And if the doctor identifies that the patient is at risk for an HAV for hepatitis A infection, then the doctor will order for hepatitis A antibody detection. So, with hepatitis A antibody detection, IgM is actually considered highly diagnostic for acute hepatitis A infection. So the methodology here is similar to hepatitis C, chemiluminescent assay. Pwede din mag-order ang doctor ng total HAV antibody. For total HAV antibody, what will be detected is both IgG and IgM. So this is just to ensure if the patient has past infection. The IgM indicates a current infection. So, if mag-positive for total HAV antibody and positive for IgM, that indicates that the patient currently has um, hepatitis A infection. But if, for example, negative for IgM but positive for total HAV antibody, that indicates past infection. So if positive for IgM, it's confirmed that the patient has hepatitis A infection. Pwede din mag-perform ng antigen detection, and the detection of antigen of a viral RNA is through molecular technique. So PCR pa rin. Immunity to hepatitis A is indicative of a positive total anti-HAV antibodies with a negative IgM, anti-HAV antibodies. Remember that IgM is a marker for current infection. But if the patient has a negative IgM and positive total anti-HAV, this total positive here is because of the IgG. So kapag ganito yung presentation, that means that the patient has fully recovered and there is immunity to that. So, what are the prevention and treatment regimen for hepatitis A? There is an available vaccine for hepatitis A, and this is given in endemic areas. Yun. So, areas that with higher risk for acquiring hepatitis A. Pwede ding convalescent plasma therapy. Ano yung convalescent plasma therapy? So, bale, kapag merong individual na naka-recover from hepatitis A infection, magdodonate siya ng blood, and then kukunin yung plasma in particular kasi nasa plasma yung antibodies. And then yung plasma ng donor, ibibigay sa isang patient who is currently infected with hepatitis A. Okay, so there is transfer of the antibody. But then again, remember ha na most of the hepatitis A infection is self-limiting. And one good prevention strategy is, of course, improve sanitation and hygiene. So, our next virus to discuss is hepatitis E, and this is the last virus that we are going to discuss in this lecture. Hepatitis E is non-enveloped single-stranded RNA belonging to the family of Hepaviridae under the genus Hepavirus. Hepatitis E is the major cause of viral hepatitis in developed countries. And there are genotypes of hepatitis A. We have four genotypes. Genotypes 1 and 2 are acquired through consumption of fecal contaminated drinking water, and genotypes 1 and 2 are the most common hepatitis E in areas with poor sanitation. Genotypes 3 and 4 are acquired through zoonotic transfer, meaning uh, hepatitis E genotypes 3 and 4 come from animals, particularly pigs. And as humans, we acquire hepatitis E genotypes 3 and 4 through consumption of infected pork or direct contact with the infected animal. The genotype 3 in particular can cause chronic infection in immunocompromised individuals. Transmission for hepatitis E is similar to hepatitis A. There is blood transfusion, possible blood transfusion, and person-to-person transmission. But the most common transmission of hepatitis E is actually fecal oral, similar to hepatitis A. The incubation period for hepatitis E is just for 2 to 9 weeks. And similar to hepatitis A, hepatitis E, most of the hepatitis E is also self-limiting. The patient will just recover within 4 to 6 weeks. So treatment may not be needed by the patient because the immune system of the patient is is proficient in terms of elimination of the virus. But if the patient is immunocompromised, of course, that requires treatment. The signs and symptoms of hepatitis E infection is similar to other forms of hepatitis. With hepatitis E, there is also viral shedding. No, katulad din sa hepatitis A, merong viral shedding. So, meaning the virus may be found in the feces of the infected individual. Kaya nga, the most common route of transmission is fecal oral. Hepatitis E, among the viral hepatitis, si Hepatitis E ang may madaming cases of extrahepatic symptoms. No, merong neurologic symptoms, renal injury, pancreatitis, and hematologic abnormalities. Dun sa hepatitis C and A, those are extrahepatic immune reactions. Whereas in hepatitis E, there is an evidence kasi of an extrahepatic replication of hepatitis E. Yes, you have heard me right. Hepatitis E does not only have tropism to the liver, but hepatitis E also has slight tropism to other tissues of our body. Example, it has tropism to neuronal tissues, to our kidneys, to our pancreas, and even to our blood cells. No? And hepatitis E actually is the most common hepatitis among pregnant women. Yes. You may have wondered, 'di ba, pareho si hepatitis A and hepatitis E na fecal oral. Pero why is it that hepatitis A ang most common hepatitis in children and not hepatitis E, na pareho naman sila ng route of transmission? Sa hepatitis E kasi, ang most common siya with pregnant women. But with hepatitis A, common siya even to non-pregnant women, even to adult men. So there is a larger population of individuals infected with hepatitis A that are able to transmit the virus to the children. Si hepatitis E, yes, merong occurrence of hepatitis E in adults, but most of the hepatitis E kasi occurs commonly in women. And ilan lang ba ang population of women? Konti lang naman, 'di ba? So yun, the the reason why the most common form of hepatitis in children is hepatitis A is because of the transmission coming from the adult. Okay? As for hepatitis E, about 10 to 20% of pregnant women with hepatitis E infection may progress to a fulminant hepatitis. Kaya it is very important to screen pregnant women for hepatitis E. Kasi if fulminant ang case, remember, pag fulminant, there is complete liver failure. And with liver failure, that is an irreversible process. No? And with liver failure, it requires liver transplant. But with liver transplant, it doesn't guarantee, no, na mare-resolve ang liver failure kasi merong liver transplants that are not successful. So, how to diagnose hepatitis E? So, similar to other viral hepatitis that we have mentioned, the screening is demonstration of antibodies against hepatitis E. So we have IgM and IgG. IgM is a marker for acute phase, and IgG is a marker for past infection. The methodology for demonstration of antibodies to hepatitis E may be enzyme immunoassay, or pwede din rapid immunochromatographic assay. Ano itong rapid immunochromatographic assay? Familiar kayo nito kasi example nito is the pregnancy test kit. Okay? So, in the rapid diagnostic test, you have a cassette kit for that. And then, ito yung component ng cassette. Okay? 'Di ba, makita ninyo sa pregnancy test kit, meron siyang C line tsaka T line. The C is the control line, the T is the test line. For the hepatitis E, IgM, IgG rapid diagnostic, tatlo ang kanyang line. The C line for the control line, the G is for the IgG, the M is for the IgM. So, if negative, okay, negative, walang linya in the G and in the M regions. Pag positive for IgM, ang ang line lang will appear on the M region. Pag positive for the IgG alone, the line will appear on the G region. But if positive for both, it will appear on both regions. Okay? So, what is incorporated in the cassette? So, in the cassette, you have here the reagents, okay? The components of the kit. So, meron dito ang HEV recombinant envelope antigen. Ito yung antigen. Antigen that is conjugated with colloidal gold. Now, what is the importance of gold conjugation here? The gold conjugation here will cause the color reaction of the line. No? Kaya nagkakaroon ng purple line. That is because of the reaction of the colloidal gold that is conjugated. Okay? So, explain natin yan later. So, yung source ng antigen natin is the HEV antigen conjugated with colloidal gold. And then, meron din dito rabbit IgG that is conjugated with gold. Okay? So, what happens? You'll apply the serum sample here or the blood sample of the patient here. So, the blood sample of the patient contains either IgM or IgG or both. Okay? If the patient has IgM, okay, syempre it will bind to the antigen. If the patient has IgG, it will also bind to the antigen. No? Kung negative, kung walang antibody sa sample ng patient, so walang mag-bind sa antigen. But if, example, meron siyang IgM, this IgM will bind to the antigen. Okay? And then, di ba, immunochromatographic ito eh. So, by virtue of chromatography, magfo-flow through ang solution. Okay? Mag-flow yan siya dyan. And then, dito sa first region, remember that the first region is the M region. In the first region, in the M region, merong naka-incorporate dyan na anti-human IgM antibody. Okay? Pero hindi pa yan siya demonstrable. Okay? Blank pa lang yan siya dyan. If the patient has IgM, okay, if the patient has IgM, this IgM here will be captured in this region here. Ano ang magka-capture sa IgM na present sa serum sample ng patient? It is the anti-human IgM antibody that is impregnated in this region here. So, this anti-human IgM will bind to the IgM and will capture the IgM. And if ma-capture ang IgM dito, okay, the colloidal gold here will produce a purplish line coloration. Okay, kaya nagkakaroon ng line on this region here kung merong IgM ang patient. But for example, wala siyang IgM. So, kung wala siyang IgM, wala. Diretso lang yan. Walang band na mapoproduce in this region here. If the patient has IgG, so this IgG will bind to the antigen. And then this IgG will be captured in the G region. Bakit? Kasi doon sa G region, merong naka-impregnate na anti-human IgG antibody. This anti-human IgG antibody will capture the IgG coming from the patient sample. So, ika-capture niya yan. Pag na-capture niya yan dyan, there will be a consequent purplish color that will appear in this region. And that indicates the presence of IgG. Okay? Now, ma'am, what if walang IgG tsaka walang IgM? Kung walang IgG, walang IgM, walang antibodies na mag-bind sa antigen dito. Okay? So, kung walang antibodies na mag-bind sa antigen dito, walang reaction na mangyayari. However, remember, meron tayong isang molecule here in the form of rabbit IgG conjugated with gold. Okay? Anong mangyayari? Kung walang IgM, tsaka kung walang IgG, this rabbit IgG conjugated will just flow direct specifically until in the C region. In the C region, merong naka-impregnate na anti-rabbit IgG antibody. So, this impregnated anti-rabbit IgG antibody will capture the rabbit IgG conjugated with gold. Pag ma-capture niya yan dyan, there will be a consequent purple color line that will appear. Okay? So, if the patient doesn't have the antibody, meron pa rin talagang line na makakreate dito sa C region. Because the line here is because of the reaction of the rabbit IgG conjugated with gold that is captured by the anti-rabbit IgG antibody impregnated in the C region. Okay? Now, the C region here serves as a control check. Okay? Because class, if during testing, wala kayong makita na line sa C region, that invalidates the testing. Kasi dapat meron talagang linya sa C region. Pag merong linya sa C region, that indicates that the kit is working, that the kit is not expired. But if after testing walang linya sa C, that is invalid because most probably the kit is already expired or the kit is already contaminated or the kit is no longer working. Okay, ganun yung indication pag walang linya sa C region. Okay? I hope that's clear. And then demonstration of the antibody is the screening and the confirmatory is the demonstration of um, antigens present in the serum sample. Okay? So, we can also use liver enzymes as a diagnostic criteria kasi nga, 'di ba, this is hepatitis. So, we can expect that liver markers will increase. As for confirmation of the infection, confirmatory is through molecular technique, detection of hepatitis E viral antigen in the serum sample of the patient. Okay? So, the sample may be used are blood or stool. Remember na merong viral shedding in the feces. So, the virus may be found in the stool. So, therefore, we can use the stool to detect the presence of the virus. Okay? But the most common is the blood, and the blood ang ginagamit if the infection is on its early phase. As for hepatitis E, no, the standard gamma globulin treatment is actually not effective for hepatitis E infection. Vaccines may be available, but it is not widely distributed. So, it's not like, 'di ba kasi sa hepatitis B, it's a common vaccine available worldwide. Hepatitis E, certain areas lang ang merong available ang vaccine. So, the treatment that can be given to the patient is merely a supportive regimen. Kasi remember din na this type of hepatitis infection is self-limiting. So, pwede na maka-recover ang patient even without given with antiviral regimen. So, what can we do is to support the immune system of the patient. So, hydration, and then supplements such as vitamins and minerals to boost the immune system of the patient. And of course, to prevent HEV infection, good sanitation and hygiene practices must be implemented. Kasi nga, 'di ba, HEV is transmitted via fecal oral route. So, the best that we can do to prevent this transmission is to improve our hygiene and sanitation practices. So, dapat hugas ng kamay talaga. So, as a summary for the three hepatitis virus that we have discussed, A, C, and E, For hepatitis B and D, that will be due to our next discussion kasi mahaba-haba ang hepatitis B. Okay? So I hope that you learned something in this discussion. If you have question, kindly post them in our content discussion forum in Canvas. Thank you so much for your time, for your effort, for listening. Good day.